So the question is, what prevents clotting? The major function of the platelet is to clot blood. So once platelets are in circulation, their function is to initiate blood clotting. And so the big question tonight is, what prevents clotting? If platelets are in circulation, why don't them clot blood automatically unless there is vessel damage? So what happened? Right? What happened? So there are three mechanisms that involve, okay, in the prevention of what? Clotting. So three mechanisms involve that keeps the blood naturally firm, which prevent coagulation. Then the first one is secretions from endothelium. The endothelium is the layer, okay, the vessel layer, okay. The endothelium secretes so many, proteins or factors that prevent blood clotting. So another one is the role of a protein or a substance we call the heparin sulfate. This one is a natural anticoagulant. We talk about that. What does it do to prevent clotting? And another protein we call the thrombomodulin. Thrombomodulin also play a major role in prevention of clotting. So the first one, secretion from endothelium. Now, the endothelial cells secrete two important chemicals. What are the chemicals? You have the nitric oxide and you have prostacyclin. These two chemicals are very, very important. And what do? Now, anytime the blood is in circulation and there is, no damage to the blood vessel, what happens is that the endothelial cells of the blood vessels keep on secreting these two chemicals, nitric oxide, prostacyclin. Their role is that the nitric oxide and the prostacyclin, they naturally inhibit the platelets and keep the platelet inactive. Therefore, they prevent it from binding to the endothelial lining. Understand? So, blood vessels, when they are not damaged, their endothelial cells within the endothelium, they produces the nitric oxide and then the prostacyclin. And the nitric oxide together with the prostacyclin has that ability to naturally inhibit the platelet. So that even though the platelets are in circulation, they are being inhibited from binding to the endothelial lining. If they are able to bind to the endothelial lining, they are going to cause unnecessary blood clots. And therefore, if you have these chemicals to prevent the platelets from doing that, then there is not going to be any clotting process. So the first one I want you to keep in mind is that when the vessels are not damaged, the endothelial cells within the endothelium of the rest of the blood vessels releases these two chemicals, the nitric oxide and the prostacyclin. Of course, the nitric oxide and the prostacyclin, like I've already said, inhibit the platelet and keep the platelet inactive. Once it does that, it prevents the platelets from binding to the endothelial lining, and hence there will not be blood clots. So this is one mechanism that the body uses to prevent the blood from clotting. Okay, so that is why we walk around, we don't see that our blood clots anyhow unless there's vessel damage. Okay, unless there's vessel damage. So once the blood vessel is not damaged and everything is intact, endothelial cells within the endothelium produce nitric oxide, prostacyclin, and they will also come in circulation to hold platelet at a stand, keep it away from binding to the endothelial lining. By doing so, no unnecessary clot occurs in the body. Then another protein I said is heparin sulfate. This is a natural anticoagulant. What role does it play to prevent blood from clotting? The heparin sulfate causes the activation of antithrombin 3. And what does it do? Once the antithrombin 3 is activated, leads to the degradation of certain clotting factors in the bloodstream. You understand? So the coagulation cascade is not only platelets. We have certain clotting factors that are being produced by the liver, which are always in the bloodstream. The heparin sulfate is serving as an agent which causes antithrombin 3 activation. When the antithrombin 3 is activated, it can lead to degradation of certain clotting factors in the blood. These clotting factors, some of them are factor 2, factor 9, and factor 10. These factor 2, 9, and 10 are important factors. Factor 2 is the thrombin, 9 and 10, they are very important factors which we will talk about along the way. Okay, without these factors, the clotting process become invalid. And so what heparin sulfate does is to stimulate something that can degrade these factors and clotting ceases. So you see the role of heparin sulfate, very important. Then the third one is thrombomodulin. What does it do to prevent clotting? Thrombomodulin binds to thrombin. Thrombin is factor 2. Once thrombomodulin binds to thrombin, it activates it. But then when thrombomodulin comes to the system, it activates thrombin, and thrombin also moves to activate protein C. So in the presence of thrombomodulin, thrombin becomes activated. Once thrombin becomes activated, thrombin also activates protein C. What does protein C do? Protein C inactivates factor 5 and factor 8. Very important factors we can't do away on the intrinsic pathway. Factor 8, a very important factor in the intrinsic pathway. And so if we can get anything that inactivates it, these are three important factors that play a major role and prevent blood from clotting when there is no vessel damage. I guess we can put this in mind and follow the lesson keenly. There are some few mechanisms that involve in blood clotting. Blood clotting is a whole system of its own. Apart from knowing that there are factors that prevent the blood from clotting when there is no vessel damage. What about if there is vessel damage? Of course, there will be leakage of blood, and we don't want that to happen. Remember, I said homeostasis, the desire to prevent the leakage of blood, especially our red blood cells, when there is a vessel damage. And so there are so many mechanisms that involve in this. The first one I'm going to talk about is vascular spasm. The vascular spasm basically involves the blood vessels. What is vascular spasm? What is the role? What role does the blood vessels play when it comes to blood clotting? Then the second one I'll talk about is platelet plug formation. So right after vascular spasm, there's what we call the platelet plug formation. What is it? That one involves the platelets. So follow the video keenly. We talk about this. Then the third one is the coagulation process itself. So the mechanism, we start from vascular spasm involving the blood vessels. We come to the platelet plug formation. That's the role of the platelets in blood clotting. Then we come to the coagulation, which involves clotting factors. The next one, we're going to talk about the clot retraction and repair. After coagulation, after coagulating factors understand their role, the clot should be taken back, should be retracted, and then the vessel should be repaired. And so we also talk about that. Then the last one is fibrinolysis. So there will be formation of fibrin. By the end of the day, we have to break the fibrin back. So how do we do that? Some mechanisms involve in blood clotting. Remember, anytime a vessel is damaged, the blood vessel itself contributes to the clotting process, which is called a vascular spasm. Then platelet come into play. That is the platelet plug formation. That is the role of the platelets. Right after that, there is coagulation. That is where the intrinsic and the extrinsic pathway. And then point number 4, after the coagulation, there's clot retraction and repair. Then the final process is fibrinolysis. So these are the 5 major mechanisms. In this video, I will talk about the vascular spasm. Then our next video will talk about the platelet plug formation. So vascular spasm. Now, in vascular spasm, okay, what we have to understand is that the blood vessels. Let me show you. So this is the blood vessel. This is the endothelium of the blood vessel. You see. Now you take the endothelium. Above it we have the subendothelial layer, which is called a tunica intima. Okay, we also have the elastic membrane. We have the smooth muscles. We have the tunica externa. The point I want us to take from here is that the endothelium is from the basis of the blood vessel, and within the endothelium we have what we call the endothelial cells. Remember, I told you that when there is no vessel damage, endothelial cell releases 2 chemicals. So this is how they look like. These are the endothelial cells. They play a major role. The reason for this picture is for you to understand that the vessel contains elastic membrane, some muscle fibers, and even collagen fibers. Okay, we talk about that. And so going back, what we're going to talk about in vascular spasm is very simple. So in vascular spasm, okay, what happens? Now remember that hemostasis, okay, hemostasis usually occurs in the arterioles and the venous. So the smaller blood vessels, that is where hemostasis occur. It doesn't occur in the veins, it doesn't occur in the arteries, but it occurs in the arterioles and the veins, the branches, okay, the smaller vessels. And so remember that endothelial cells line lumen of the blood vessel. And so like the picture I showed you, you have the endothelium. Within the endothelium, we have the endothelial cells. Then go into it. The luminal side is coated by glycocalyx. Glycocalyx is composed of carbohydrates and proteins. So the luminal side of the blood vessel is coated by glycocalyx, meaning that it contains some carbohydrates and proteins. Then there is another side which is called the abdominal side, which is also attached to basement membrane of the vessel, and that one contains collagen type 4 and some proteins. And of course, what I want you to understand is that the blood vessels contain some carbohydrates and proteins, including some collagen fibers. Remember always that the vessels are non-thrombotic under normal circumstances. Okay, so like I already said, the blood vessels are non-thrombotic, meaning that under normal circumstance, if there's no vessel damage, okay, the blood vessels do not promote, clotting process. You understand? So the blood vessels always make sure that they keep their blood in constant flow. And like I said in the first video, they do that by releasing certain chemicals like the nitric oxide, the prostacyclin, even thrombomodulin. Very important to know that the vessels under normal circumstances, if they are not damaged, they don't promote coagulation or hemostasis. They are non-thrombotic. So they inhibit platelet activation, and I've already talked about this by releasing prostacyclin and nitric oxide. Okay, and then we have another enzyme we call the ADPs. We talk about that. But the most important ones that I want to put in mind is that under normal circumstances, the blood vessels are non-thrombotic. How do they inhibit platelet? How do they prevent platelets from clotting blood? Like I said earlier on, they release prostacyclin and nitric oxide, okay, and of course prevent ADP synthesis. Of course, they also inactivate thrombin, and I've already spoke about the role of thrombin, which is factor 2, play a major role in the common pathway. It's a clotting factor which is very important when it comes to blood clotting. But then, once again, because the blood vessels are non-thrombotic under normal circumstance, they cause inactivation of thrombin. What does thrombin do? Thrombin, when it is circulation, facilitates the clotting process, and so we don't want that to happen. Therefore, blood vessels produces what we call the natural anticoagulant, which we call the heparan sulfate thrombomodulin. And I've already spoke about the role of heparan sulfate and thrombomodulin in the first chapter of this video. So you go and listen to that. Now, the damaged vessels are prothrombotic. Once a vessel is damaged, okay, it exposes or it poses challenge to the body to enhances the clotting process. And so under normal circumstances, when vessels are not damaged, they become non-thrombotic, and all this process occurs. But once they are damaged, they become prothrombotic. So once they are damaged, the exposure of the subendothelium lining, okay, to platelets, and there will be collagen platelet activation. We talk about that, and that is where the clotting process starts. Then once there is collagen platelet activation, there is what we call secretion of platelet activating factor. Secretion of platelet activating factor. Platelet activating factor is very important because it activates the platelet. It sends information that, hey, platelet, there is vessel damage. Let's move to the site of injury. Let's go and cause, platelet plug, okay, so that our precious red blood cells will not move from the body. And this occurs only when there is a vessel damage. Only when there is exposure of collagen or the endothelial lining, which is made up of collagen, to platelet. That is where platelet activating factor comes in, activates the platelet, and this process occurs. Another important thing that we shouldn't forget is the secretion of a protein we call the von Willebrand factor. The von Willebrand factor. The von Willebrand factor is very important in platelet adhesion. So what is platelet adhesion? And this we're going to talk about it when we go to the role of platelets in blood clotting. What I want you to remember is that all this process occurs when blood vessel is damaged. First of all, there's secretion of platelet activating factor, which is going to activate the platelets. And there is also secretion of von Willebrand factor, which is going to cause adhesion of platelets. And this facilitates the clotting process. Once again, there's release of tissue factor. Tissue factor is in secondary hemostasis activation. Tissue secondary hemostasis activation. So I'm going to talk about secondary hemostasis and primary hemostasis. What are they? Okay. All these processes occur. Platelets become activated, secretion of von Willebrand factor happens, release of tissue factor. All these also play a major role in the coagulation process. So the blood vessel, I've spoken about that. So in summary, in vascular spasm, okay, blood vessels contract or they constrict in order to decrease the amount of blood loss when there is a vessel damage. So in vascular spasm, that's what basically happens. Okay, when there is a vessel damage, I've already spoken about the role of the vessels, the non-thrombotic role and the prothrombotic role of the vessel. But in vascular spasm, what actually happened? What is the rule? How does a blood vessel also prevent clotting? And so once there is a vessel damage in vascular spasm, what happens is that the blood vessels either contract or constrict in order to decrease the amount of blood loss when there is a vessel damage. And they do that using three mechanisms. The first one I'm going to talk about is what we call the endothelin secretion. The blood vessels secrete a protein we call endothelin. This occurs when there is a vessel damage. Now, damage to the endothelial cells stimulate the cells to secrete a molecule we call the endothelin. Listen, when the vessels are damaged, damage reaches the endothelial cells. This is after vessel damage. Okay, remember I told you that when the vessel is not damaged, these same endothelial cells releases the nitric oxide and other factors to prevent clotting. But listen, this time around there is a vessel damage. So the endothelial cells also produce another molecule we call the endothelin. What does it do? Endothelin binds to receptors on the muscle beneath the subendothelial layers and causes vasoconstriction. So endothelin, its role is to bind to there are receptors on the muscles beneath the subendothelial layers of the vessel. Remember when I showed a picture of the vessel? I show you that there is a region we call a subendothelial cells that contain smooth muscles. On that smooth muscles, there are receptors for endothelin. So it binds to those receptors and causes what we call vasoconstriction. What does vasoconstriction do? Once there's vasoconstriction, the diameter of the blood vessel decreases, and then it will prevent excessive loss of blood. So this is one mechanism that the vessel used to prevent blood from clotting, secretion of endothelin. Another one is myogenic mechanism. What is it? Here there is contraction of the smooth muscles beneath the blood vessel when there is a direct injury or contact to the vessel. So when there is direct injury or contact to the vessel, the smooth muscles beneath the vessels contract. They contract, and once they contract, they reduce the diameter and, of course, prevent leakage of blood. Then inflammatory chemicals. Inflammatory chemicals stimulate nociceptors. Now, nociceptors are pain receptors, okay, which are on the vessel. Now, these pain receptors initiate pain. And while there's pain, there's vasoconstriction, which is also promoting vascular spasm, reducing the size of the vessel. And so basically, these are some few mechanisms that the blood vessel employ when there's vessel damage to reduce flow of blood. Remember the topic, hemostasis. We don't want our red cells to move out. We don't want our blood cells to move. So we want any mechanism, okay, to maintain the blood in a fluid state, to limit the clotting process to site of injury, okay. And of course, one of the mechanism is vascular spasm. And like I said, this is basically what happens when there is a vessel damage. And so there can be certain disorders, certain diseases in the blood vessel, and may distort the process of vascular spasm. So the cells of the vasculature affecting hemostasis. Remember this role played by the vessel. If there is any disorder to the blood vessel, it can also prevent this role and therefore it will distort hemostasis. These disorders can be hereditary, can be inherited, and they can also be acquired from the environment. And so first of all, let's talk about the inherited ones. The first one is called the hereditary hemorrhagic telangiectasia, which is also called Osler-Weber-Rendell disease. What is it? This is inherited disorder, okay? This is abnormal formation of blood vessels in which arterial blood may flow directly into a vein without passing through a capillary. So in this condition, there is abnormal formation of blood vessels. And this time around, instead of the blood from the artery to pass through capillary before getting to the vein, because of this disorder, the blood moves straight to the vein. The flow of blood is changed, and this affects hemostasis process. Now the connecting area is often fragile and ruptures easily, resulting in bleeding and bruising. Okay, so once this happens, once there is a abnormal formation of the vessel, the area connecting the arterioles, the capillaries, the vein become fragile and then ruptures easily, and this will lead to continuous bleeding and bruising. So this is one common, inherited others. Okay, because it is vessel. The blood vessels do not form well, and therefore instead of blood moving from the artery capillary before it goes to the vein, it just moves straight to the vein. And when that happens, the connecting areas become fragile and there's continuous bleeding, which affects hemostasis. Okay. Then another one is Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. What is it? A connective tissue disorder which is caused by mutation in collagen synthesis. So, like I said, the blood vessels contain a lot of connective tissue which are made up of collagen. Now, collagen is a protein, therefore, it should undergo protein synthesis. Now, during the process of protein synthesis, maybe some of the genetic material may be mutated, and therefore, once there's mutation, effective synthesis of collagen, which may affect the connective tissue. And so, Ehlers-Danlos syndrome is basically a connective tissue disorder. And how does it happen? Because there's a mutation in collagen synthesis. This results in fragile and easily broken of blood vessels. So those blood vessels which has impaired collagen, okay, they become fragile and they break easily. Therefore, continuous bleeding and then distort the hemostasis process. So those are the inherited disorders. Then acquired ones can acquire from the environment. Common type of purpura, more common types, those that decrease connective tissue level. One is senile purpura. Here there is degeneration of the skin matrix, which result in weak capillaries. Okay. Then you have the excess glucocorticoid. Here, excess glucocorticoid when there is Cushing syndrome. Okay. And therapeutic glucocorticoids can result in vessel fragility. Then vitamin C deficiency, those with scurvy. Okay, there is a problem with collagen synthesis, and so the vessel become fragile and always can be bleeding in that order. Then we can have conditions that may be due to paraproteins. One is amyloidosis. Amyloidosis is the position of amyloid material in vessel, leading to fragility. Then can also cause thrombosis. And so with amyloidosis, there's the position of amyloid materials in the blood vessels. Once amyloid materials are deposited in the blood vessels, the vessel becomes fragile, breaks easily, and then bleeding occur. Thrombosis is a major factor that can happen. And then some paraproteins. Okay, many different effects depending on the type of malignancy. So we see paraproteins there, that then there can be inflammation to the blood vessel, which is called vasculitis. Inflammation of blood vessel leading to complement activation. Okay. Then we have another one, Henochscope purpura. This is considered to be another form of vasculitis, but it is more commonly seen in children. Okay. And so these are the acquired disorders. We can just take them from the environment. We can just, acquire them easily. All these affect the blood vessels. And when this happens, it may terminate or distort their role in coagulation. And so that's the end of the first video. In the next video, we're going to talk about platelet plug formation. What is